How did you even get
Yes.
T1D? What was the diagnosis? Like, when did it happen?
I found a walk-in clinic at a hospital. They took a blood sample and the doctor said to me, you've got diabetes, your sugar levels are really high. They hooked me up with all the machines, they put me on an insulin drip. I looked at this and I looked at my finger and I just broke.
My name is Reese and I've lived with type 1 diabetes for over 4 years. I'm on a journey to meet other Vertex employees who live with the disease as well, to really truthfully understand what it's like to have type 1 diabetes.
So I woke up with paramedics standing over top of me.
There was this level of, honestly, guilt and shame.
I felt judged.
I just feel like I beat myself up for a lot of it.
All I want to do is curl up on the ground and cry about it.
I showed up to work today with a mission in mind.
You're good, dude. Don't mind the camera. We're after one man.
That mission was to spend some time with Aziz.
Yes, sir. How are you?
You're right.
Good to see you. What?
Good to see you too.
Aziz has worked at Vertex for over 10 years. He's a father, a husband, he essentially lives in the gym. And like me, T1D changed his life forever.
You had lunch?
No, I need to eat lunch.
What's your levels? You're on a 5-0 coming down.
Although we're in different teams, Aziz is one of my closest colleagues at work, and we clicked through having T1D. But we've never actually sat down to discuss how we both live with the disease. After he got his lunch, it was time to break the ice.
I don't know about you, but even seeing you inject yourself then, I haven't actually seen someone inject themselves in
and to be fair, like
forever.
I've always done my injections out of sight from everybody kind of thing. I've just kind of, not advertised it.
Yeah, no, same. I first would do it in the toilet.
Yeah,
for like,
exactly. That's
for
right,
like
yeah.
2 years.
Yeah.
Crazy though.
I don't know, as time is going and there's more awareness coming out about type 1 diabetes and stuff like that, I don't know. I think I feel a little bit more comfortable doing it in public. I mean, it's part of me, it's part of my story, it's part of who I am. So I feel less guarded, I think.
Every time I'm with someone else who has type 1 diabetes, we inevitably compare our glucose levels.
Do you know what? So doctors tell you what, it's like 70% and above is what you should, is good?
I got told 70, yeah.
Look at this, 91% in range for like a 3-day period.
What was you doing differently?
To be honest, watching this app like a hawk.
It seems maybe on the outside it's just easy to stay in that range, but it's actually not. And there's a lot of people that aren't in that range, that aren't staying in it.
We're so hard on ourselves. I felt like I want to do better. 70% is what they tell you and is the guidance, and it's difficult to maintain.
After Aziz finished his lunch, we took a walk outside the office to grab ourselves a coffee.
I'm not conscious of how many decisions I make and how many parts of my life have to do with this.
I mean, it's a lot of brain capacity. You do think about it a lot.
When I saw Aziz earlier, he showed me the glucose tablets he always carries with him.
I usually buy boxes of them from Amazon. Like a pack of 20 or something like that.
Glucose tablets help raise your blood glucose levels and are used predominantly when you're going low. For Aziz, they are a key ingredient in his management.
Working with diabetes at the same time is difficult. Like, if I'm presenting and my sugar level starts to go low, because you want to be professional, you don't want to be like, oh, sorry, just like, I need 2 minutes, especially if you're the one leading the presentation. More often than not, I'll try and avoid it going low by taking glucose tablets, so then I end up coming out of the meeting and my sugar level's high instead. Personally, I've opted to go for that route because it's less visible and I can still think and talk. Whereas when your sugar level is low, like you start getting like a little shaky and difficult to articulate yourself. So that's kind of how I've
still in that high, which long term...
Yes.
Sometimes life, when you have type 1 diabetes, it can feel like you have limited options, choosing between short and long-term consequences, always deciding the lesser of the two evils.
Yeah, I mean, it is challenging, but we're adaptive as human beings, aren't we? We just got to try and get through it as much as we can.
Living with T1D has definitely shown me how to get through hard things. But like Aziz said, it can be challenging. I want to understand more about how Aziz learned how to adapt after his diagnosis. So we made our way to his house the next morning. I jumped on a train at London Paddington and made my way to Oxford. But of course, when you have T1D, anything can happen.
This morning when I was at the train station, I said I was up going like at 11.7 with an arrow kind of 3/4 going up. And then I gave myself 5 units of insulin and I kind of thought, oh no, I've given myself 5. And I was a little bit like, is that too much? Of course it was. So that's 4.7 with a straight arrow going down, which probably means I'm gonna be feeling a little bit lightheaded, dizzy within the next 10-15 minutes. So anyone got any, and we have no supplies, do we? Classic. Ah, we're here. We are here.
Hello?
I let Aziz know my current levels and headed straight to his kitchen. It's okay, we're friends.
I was saying how easy it is. You go around someone's house who has T1D, you're like, give me some food, please.
To say the relationship with food is tricky as people living with T1D, well, that's an understatement. You have to be conscious of any food or drink you consume.
I think before I was diagnosed, I just eat whatever I wanted to eat. You don't put any thought behind what it's actually going to do. You like the taste of something, you like the look of something, you eat it. Since being diagnosed, like, you have to know what you're eating. Because effectively what we're doing is what our body naturally does without having to think about it, but we've got to think about it.
My sugar levels were thankfully starting to stabilise, so me and Aziz sat down in his living room to digest. I love that you still play with your toys.
You see the kitchen over there is not enough. I need to have one here with me as well.
Yeah. Well, dad life.
Yeah.
You've got T1D and you've got to be a dad and you're a husband as well. Is that tolling on you? Does it feel like a lot?
We've got one daughter, and when she was a newborn, she struggled with colic and reflux. Every day between 8 p.m. and 9 p.m, no matter what I did, no matter what Hazel did, she was uncomfortably in pain, so she would scream. In those moments, I'm like holding her and she's finally settled and she's finally sleeping, and I can feel my sugar levels out of whack, and I'm like, I just gotta wait. Like, I just gotta wait until I know she's down and she's calm so that she can go to sleep, and then I'll sort myself out after. It was so difficult. Those moments, don't get me wrong, there's lots of joys as well, but there were very, very difficult moments. And when me and my wife were planning to have a child, one thing I was conscious of is how hypos and when your sugar level goes low can affect how you react. I used to get really frustrated and short, and so I was worried that having a child, I don't want her to have memories of daddy snapping at her because my sugar levels are up or down. I don't know, maybe over the last 5-6 years, I feel like I don't react in that same way anymore. I would consciously try and take a minute and think to myself, how is she gonna remember these conversations? The other thing is the risk of her having diabetes. My heart goes out to children that live with diabetes and their parents, because for a child, they don't know what's going on. Like, I think the family burden for a child specifically with diabetes is a lot. I feel grateful that I was diagnosed when I was an adult, because I can technically look after myself. I know what's happening. I know what's happening with my body. I know how I'm feeling. I can make the changes that I need to be able to be okay.
How did you even get
Yes.
T1D? What was the diagnosis? Like, when did it happen?
I was in my second year of university. So it was exam season. I was sat in the exam hall and I looked up at the clock to see how much time I have left. And the clock was blurry. That was the initial kind of the first symptom I remember noticing. I found a walk-in clinic at a hospital. They took a blood sample and the doctor said to me, you've got diabetes, your sugar levels are really high. I ended up spending 3 days in the hospital. My glucose levels, the normal range is between 4 and 7 millimoles. Mine was like 28 or 29. They hooked me up with all the machines. They put me on an insulin drip. I looked at this and I looked at my finger and I just broke. Like I cried. Like I was like, went through that initial phase of like, why me? Like, have I done something in my life that's meant that this has happened? once I'd gotten over the shock, I was like, okay, this is my situation now. What's in my control? What do I need to do? And it was exercise and basically look after yourself. I'm grateful to have a gym in my garage. My daughter, she sees me in there working out and stuff like that. I want her to see that Daddy might have this, but he still does the things that he wants to do. He can still achieve things, he can still do things, he can still live a life that he wants to live.
Hearing where Aziz started out at his diagnosis to how far he's come now, how he's shifted his thinking, he's right. T1D should not stop us from doing the things we care about.
I mean, this is amazing that you have your own gym.
Every person needs an outlet because life is stressful, and I feel like this, for me, has been mine. Doing something to help kind of clear your mental space is important to be able to get back on track and know that you need to knuckle down, basically.
You feel like it can get too much sometimes.
Yeah. Sometimes I'll have an appointment with the doctor and I feel apprehensive about being completely honest about what my lows are, what my highs are, because I felt judged. I don't want to say that I'm having low sugar because I'm supposed to be managing it well. You put that pressure on yourself because you're ultimately trying to do what your body is made to do without you thinking about it.
It's fascinating how much insight Aziz has. He's had T1D for much longer than me, and I really want to dig deeper and hear about his experiences when he goes low.
You feel shaky, and like we were saying earlier, you can feel agitated. It feels difficult to focus and to actually do normal things. You need like 5-10 minutes to just be able to sort yourself out so that you can kind of come back to reality. I used to have a lot more hypos when I was doing finger prick tests. Hazel can attest to it as well. Like in the middle of the night, you get up with sweats.
Oh,
Next thing you
man.
know, she's hearing me crunching down those glucose tablets in the middle of the night. There was an instance where I injured my finger, and when I injured my finger, I didn't realize how much you need your two hands, particularly when you're taking injections. Hazel basically was a bit of a caregiver for me for a period of time because I couldn't take injections myself.
Hazel was, you were looking after him, yeah?
Yeah.
So you were doing his injections.
Yeah, it was.
What was that like?
It was a lot to actually have to do that for someone daily. It actually puts you in their kind of shoes and sort of shows you what they have to do every single day.
But Hazel, you've been here you was there.
When you're diagnosed.
Yeah!
Yeah.
You've been here from the start with this
Yeah.
whole thing. You've kind of, obviously you haven't got T1D yourself, but
Yeah.
wow, you've seen it all.
Yeah.
I've got a question. What did you think when I was laying in the hospital bed and you slept on the
hospital couch.
the hospital
couch.
the couch? What was going?
I don't know. I just wanted you to
think
be
it
okay.
was? Oh.
Yeah. Yeah. I just wanted you to be okay.
Oh my god! Actually, I'm getting a bit emotional. Oh my god! I love you.
I realised this was my cue.
Well, bro, thank you very much.
Thanks for coming.
Appreciate
Thanks
your
for
time.
hearing me out.
You in tomorrow?
Yep.
Go on,
Yeah, I'll see you there. Take care.
They're right. When you live with type 1 diabetes, you spend so much time just making sure you're okay. But I walked away from today feeling empowered, yet seen. From spending more time with Aziz, I could see how he refuses to let T1D stop him from living the life he wants, in his work, with his family, in everything he does. But I also heard fear and the challenges. Due to our immense ability to adapt, fear and challenges that I now understand become normalized when you live with this disease. Fear of how it might affect his daughter, that next appointment with his doctor, even the future. It was a powerful reminder that living with type 1 diabetes is never easy, despite how it may look from the outside.